Well, greetings. I'm here to talk to you about neuromas. Neuromas. I know I've talked a lot about this. I have a website called neuromasecrets.com. And no, that's the second most common problem we see here in this practice, besides plantar fasciitis being number one. Neuroma is number two. So, why do we have such a big problem with neuromas? Well, the nice narrow shoes that everyone likes to wear and the shoes without padding. Those are the two most common problems why we get neuromas. So, what are neuromas? Right here. Right here shows an inflamed nerve in between the two knuckles. What can we do about it? What are the treatments? Well, the neuromas are inflamed nerve in between the metatarsal heads, as you can see, caused by, like I said, tight shoes that causes a squeeze of the metatarsals, causing the nerve to get inflamed. Or if you wear shoes without padding on the bottom, you get, I would say, you get inflammation of the joint and inflammation of the nerve on the bottom. Those are two most common causes that we see why you have neuromas. Now, what's the big deal about neuromas? Well, one of the typical treatments for neuroma is after you exhaust conservative care, surgeons will go ahead and cut the neuroma out. It's called neuroma excision. It's a fairly common procedure that we do, but unfortunately, it is very risky as far as complications. You never know who's going to do well and who's not going to do well with the neuroma surgery. It is rewarding when it goes well and disastrous when it does not. Again, we don't know. Stump neuromas are very common. I mean, studies have shown as high as 50%. Some say 20% of people end up with it. Well, if you're in the unlucky 50 or 20%, your life is going to be terrible. So, what do we have? Well, that's why I look for alternatives when it comes to that. And the alternative that I found that's great is we have radiofrequency ablation, where I go in and I burn the nerve, or what we're discussing in the following of this is a patient that had what we call a decompression. Decompression with translocation of a nerve. What does that mean in English? Basically, I showed this to my patient when I talked about this. If you look at this right here, let me see, it's probably right here. If you go ahead, there's a ligament on top. We're looking from the bottom up. There's a ligament on top of that nerve. This ligament right here. It's on top of that nerve, and that's your neuroma. There's that same ligament on top of that nerve. We're looking from the bottom up. Cut that ligament right here. We cut that ligament surgically. Open you up, cut the ligament surgically. And then we take that nerve, which is on the bottom, we'll move it above that ligament and suture it to the joint capsule. So essentially, I'm taking a nerve that is, let me see, got a good picture here. A good picture here, right here. Essentially, I'm taking a nerve from the bottom that runs right here on the bottom. There's a ligament right here. A ligament from the bottom, a nerve from the bottom. There's a ligament right here that we're talking about, the deep transverse metatarsal ligament. The same ligament as I showed in the other picture. I cut that ligament. The nerve is lying here, and I move the nerve all the way to the top. It's very easy to do. Free it up from the soft tissue. I move the nerve from the bottom of the foot to the top of the joint capsule, and I sew that nerve onto the joint capsule. Why does that make a difference? Well, number one, you're not walking on that nerve anymore, so that's why it makes a difference. And right now, you're gonna see a patient that had this done, and take a look at the scar. She's 3 weeks out. Hear her story, and it is a very typical of our patients that have had that done. Thank you. Any pain?
Nope.
Any pain?
No.
Good. So I think you can recover very well.
Okay.
Okay. Well.
Thank you.
Thank you for being an awesome patient. We're gonna watch your recovery. See you back in 6 weeks, and it should be all done.
All righty. Thank you.
Yeah, you're welcome. Beautiful.